Human Services Committee to order. And I want to thank everybody for being here today. I guess we're getting a presentation from child protection workers, and thank you all for coming in. This is really cool to have everybody in the room. Before we get started, though, we need to approve the minutes of the last meeting. That you received them in your packet.
I'll second. I'll move.
Commissioner Nissen moves. Commissioner Berg seconds. Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Very good. Got that out of the way. Now we get to hear the good stuff. So we're going to get started with Heather Jeseritz from the United Community Action Partnership. And our focus today is going to be on child protection.
So today I'm here, after me, you get to the good child protection stuff. That'll be the reward for listening to me. I'm Heather Jeseritz. No, you're totally good. Heather Jeseritz with the United Community Action Partnership. I'm the Family Services Manager. And every 2 years we come before you to seek support in our family homeless assistance and prevention resolution. It's a 2-year grant that we write. The term of this funding period will be September 1st, 2021 through October 30th, 2023. And we use these funds to try to stabilize families who are currently homeless into stable housing, retain housing for those at risk or facing homelessness, mortgage foreclosure prevention, things of this such. One thing we like to share is because that does sound like it duplicates or replicates emergency assistance services through what the county social services does. We do partner with them. There's oftentimes we work with families, they work with families. We kind of coexist in that world of supporting one another when one service might not resolve the situation, but collectively they will. The resolution covers our 9 counties that UCAP serves all the way down to the Iowa border. And then we also do the lower 4 counties of the southwest corner of the state as well. And then we're a lead grantee for Prairie 5 Community Action to our west. So it's a little under $2 million grant application that we're submitting, covers 18 counties in southwest Minnesota. We're here asking for your support. There's no financial responsibility to the county in any means, but we do require support and for the county to understand the funds we're seeking and what we do with them. Questions?
And that is in the form of the resolution 2021-01.
It is.
Thank you. Anybody have any questions for Ms. Jeseritz? Then I would entertain a motion on resolution 2021-01.
I would so move.
Commissioner Gardner moves. Do I hear a second?
I'll second that.
Commissioner Anderson seconds. Any questions? Did you drive up from Marshall this morning? I'm just curious.
I didn't, all the way from Litchfield.
From the Litchfield. It's quite a bit of geography that you cover, and I'm guessing, I made the mistake of tying this all together, but I'm guessing there is some dots that get connected quite often between the work of child protection people and your office.
There 100% is. We have our parent support outreach program, our family-based services, some of our permanent supportive housing managers, and they work very closely with child protection at times as we do share many families by all means. And we do cover a huge radius all the way down to Iowa, all the way over to South Dakota, and then up here. So it's over 400 square miles that our agency serves.
Very good.
And we were formerly Heartland Community Action
Right.
Agency. We're going on 5 years with that merge, but doesn't seem that long. But
For those of us who cut our teeth on Heartland, it'll probably always be Heartland. But
yeah, no. Well, I've been there 20 years, so I hear you on that. So, yeah.
All right, we have a motion and a second. All in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Thank you very much.
Thank you
for
guys so
listening
much.
to us. All right, Jolynn, you're going to lead us off? Oh,
Good morning. I'm Amanda Schoenhart, the ongoing child protection supervisor. And today we will be walking you through a day in the life at social services. No day is ever the same when the staff arrive to work. Our agency currently have many staff that work directly in the field, supervise, or support in some way the child protection population for Candy-Ojai County Health and Human Services. Each person you see in this room today, along with some that could not be present, are a key piece to ensuring the safety and well-being of the children in our county. We will introduce you to these staff now. If you'll please stand when I say your name. We have lead worker Sherilyn Molden, licensing worker Constance Nelson, case aides Terry Schneider and Jody Fernholz, ongoing staff Nicole Bennett, Latoya Gaines. Danielle Himley cannot be with us today. Dana Rude. Kelsey Jones. Michelle Tejeda. Sabrina Kester. Taylor Triebenbach. Stephanie Rodriguez. Holly Schmidt. And also absent Deb Oslin.
I'm Jolynn Sundstrom. I supervise the intake and assessment unit, so I'll ask my staff to stand as I introduce them. Lead worker, Christina Jones. Primary intake worker, Michelle Wenberg. Case aides, Luann Grun. And Cindy Casanova. Our truancy worker, Becky Anderson. Adoption worker, Tina Magas. Our minor parent worker / signs of safety coordinator and backup assessor, Amanda Lager. Our family assessment workers, Sarah Banks, Chelsea Whitcomb, and Leanne Kitzman. And then our traditional investigators, Alicia Sweep, Carly Kranz, Nisa Peterson. And then we have 2 traditional investigators, Mia Saeed and Jenna Nelson, who can't be with us today. They are corner house training for interviews.
And today we will be going more in depth on the scenario you heard about at board last month. This scenario is similar to a day that recently occurred at the agency. To paint the picture of this day, we will be walking you through the following scenario. Let us walk you through this now.
8 to 8:45 a.m. The day begins with most staff arriving at 8 a.m. Upon arrival at the office, staff need to enter their time from the day prior. All staff are required to enter 100% of their day's actions into our state system, SSIS. This is entered in 15-minute increments and takes a lot of time. Along with entering time from the day, they are checking emails from staff, clients, outside professionals, and supervisors. Each morning begins with typically 30 to 40 emails already waiting to be read. Work cell phones are turned on and checked. With modern day technology, this now includes clients and professionals to reach staff not only by work phone, but by cell phone and text message as well.
Okay, so from 8:45 to 9 a.m., as primary intake worker, I receive a phone call from C6, the local drug task force, to report a local drug bust. C6 is requesting a child protection social worker to respond to the site of the drug bust immediately due to there being a child on the scene. When there is an immediate response need, I pull together a screening team right away.
9 a.m. The screening team, which consists of the intake worker, social worker, and supervisor, meet to review the report. In this scenario, Supervisor Jolynn Sundstrom, intake worker Michelle Winberg, myself, and family assessment worker Sarah Banks meet to review the report to screen in for a child protection investigation response. Investigation worker Jenna Nelson is assigned to respond immediately to the case. All other staff have to stay in the screening room to complete any other non-emergency reports that the agency received after 3 p.m. the day prior. One of the reports received was in regards to a parent smoking medical marijuana in the presence of her child and the child getting access to the vape pen. The child was 2 years old, and the response that the state requires when dealing with medical marijuana is typically a family assessment response. Medical marijuana is a fast and growing issue that is impacting child safety at times in our county. A family assessment response is different from an investigation as it grants staff 5 days versus 24 hours to respond to the report. Law enforcement is not typically involved. We do not record interviews with the family, and it is overall a more strength-based approach with the family. Maltreatment determinations are not made, and typically if support services are not needed or requested, the case is closed after the 45-day assessment and not transitioned to the ongoing unit.
9:15 a.m. Supervisor Sundstrom locates her staff, Jenna Nelson, to give an overview of the report. This is often brief and with minimal detail, as all parties involved are working in an emergency status and have little to no information as to who the child or family is.
9:30 a.m. Prior to leaving the agency to remove a child, the worker needs to ensure there is a car seat available, check out a county vehicle, and get placement paperwork. Placement paperwork is prepared by agency case aides who spend most of their days assisting social workers with any paperwork needs, such as completing discovery, entering placements in the system, doing all case filing, helping transport and supervise children for court-ordered visitations, completing record requests, backup intake, and assisting with foster care licensing paperwork. Without case aides, the agency staff would not have the time availability to meet all the state requirements that go into a child being placed in foster care. Jenna leaves to go to the location of the drug bust to remove what was reported to be a 3-month-old baby. Upon arrival at the drug bust, C6 indicates they now have 4 kids instead of 1 child that needs to be removed from the scene. Jenna contacts the agency to seek further assistance from another social worker. Supervisor Sundstrom is now responsible to find an available social worker, assign them to the case, and direct placement be found for 4 children. It should be noted that these removals often pull staff and supervisors from mandated and scheduled meetings that were on the calendar for that date.
9:45 a.m. Agency licensor Constance Nelson and the intake worker Michelle are making phone calls to the list of local foster parents in an attempt to find placement for the children. During this time, Jolynn assigns investigator Carly Kranz to assist in the removal of the children. Carly immediately gathers car seats and a vehicle to assist. Supervisor Sundstrom is reviewing state systems such as criminal records and relative search engines to see if a relative may be viable for placement. The state requires all relatives pass certain criteria in order to be considered a safe and eligible relative for licensing and placement. The state also requires we look at placing with relatives first, if and whenever possible.
Law enforcement informs the placing worker that all 4 children are being placed on a 72-hour police hold. Jenna and Carly get all of the children into the agency vehicles to return to the office. The children come with minimal belongings due to the children and their belongings being exposed to drugs. The parents are in the process of being arrested in the presence of the children and are not being cooperative. This is a very tense and traumatic atmosphere for the children to be exposed to. Without parental permission, the agency cannot just go through the home to get items for the child, even if they were accessible to the agency at removal. The social workers attempt to ask the parents about children's allergies, medical needs, and any other pertinent information. The parents refuse to speak to anyone. This leaves the social workers with no guidance as to what the child's immediate health and well-being needs are. During this time, Supervisor Sundstrom has located a relative willing to take placement of one of the children. However, this relative lives in Duluth and will be hours before they can come for the child. Investigator Alicia Sweet begins to assist with the removal by attempting to locate the father that resides locally. For this attempt, Alicia needs to do a state search, criminal history check, and discovers the father has felony drug charges pending on his background and is a predatory offender. This father will be added to the court case, however, cannot be an immediate placement option for his child. Family assessment worker Leanne Kitzman agrees to assist in contacting fathers as well. She reaches the legal father to one child. This father states he wants no involvement with his child or with CPS. This is something that sadly happens more often than you would expect. There are many absent parents that desire to remain absent from their child's lives.
10:15 a.m. During the morning search for relatives and parents, investigation workers Carly and Jenna returned to the office with 3 of the children. The oldest child from the removal, age 16, was not present at the drug bust and was not able to be immediately located. The agency has to proceed by state statute to complete runaway and missing child paperwork if the child is not able to be immediately located. Investigator Carly Kranz has to leave from assisting Investigator Nelson from watching the children, as she has to attend a court hearing that was already scheduled for that day. Investigator Kranz has another parent at the office waiting to be interviewed for another investigation. Supervisor Sundstrom requests the ongoing child protection supervisor, Amanda Schoenhart, have 2 social workers from the ongoing child protection unit assist in supervising the children. Investigation worker Nisa Peterson and ongoing child protection worker Taylor Triedenbach offer to assist in supervising the children. The children are all in one room area with toys, books, a couch, and a chair. The 5-year-old has multiple questions about her dad being arrested, wanting to know if she is going to jail,
and wanting to know when she gets to see her mom and dad again. While the social workers try to field questions with the child and avoid giving any false promises, the agency workers also trying to find formula for the hungry 3-month-old. This is hard to do as the agency is unaware of allergies or feeding barriers the child may have.
10:30 a.m. Behind the scenes of the actual removal, there is paperwork that needs to be completed ASAP. The police holds only warrant the agency custody of the children for up to 72 business hours. If this hold expires before a judge orders the children into placement, the children need to be returned to their caregivers. Lead social worker Christina Jones begins the process of getting the county attorney office involved. This includes sending over the police hold paperwork, notifying the attorney office of any individuals involved, and a brief synopsis of why the children were placed on the hold. Police holds of children require the attorney office to conduct an immediate review of the information to decide if there's enough concern to warrant a request for emergency protective custody.
Due to the children still being at the agency as placement is yet to be found, the social workers need to provide lunch for the children. The agency does not have funds to purchase food immediately for the children, and this is at the social worker's expense until reimbursement can occur. Depending on the number of children, this can be a costly expense for a social worker. In this scenario, the cost for food for all children averaged $40. Due to no local foster homes having availability to take to children, case aides step in to assist in making statewide phone calls to therapeutic and facility placement. The agency avoids using these entities for placement if the needs do not arise to the therapeutic or safety levels. It is higher expense due to administrative fees and distance. Both supervisors are working on the drug bust removal when another ongoing worker, social worker Dana Root, arrives at the office with a toddler who has moved to a new placement on this date. Due to the supervised visitation room already being occupied by another family, Dana had to supervise the children in a meeting room, which is not a child-friendly environment.
11:15 a.m. Investigator Alicia Sweep notifies Supervisor Sundstrom she has located the missing 16-year-old. Investigator Kranz goes to pick up the 16-year-old child to be brought to the agency.
11:30 a.m. Lead worker Christina Jones receives notice from the county attorney's office to proceed with writing up the party and participant forms, which are court-ordered documents that need to be submitted to the courts as soon as possible. It should be noted that CHIPS petitions are typically anywhere from 10 to 15 pages long at minimum. These take hours to complete as you need to find the information on the family, review the documents and case history, and input criminal history. Due to scheduling conflicts, Christina completes the emergency protective custody petition, however, does not have the availability to complete the 2 CHIPS petitions at this time.
12 o'clock, ongoing worker Taylor Treibenbach, who now has been supervising the children in the visit room since 10:15, needs to find another worker to assist in supervising the children as she needs to go and pick up a parent for a court-ordered supervised visit. Ongoing social worker Danielle Himley agrees to come and assist with watching the children in the supervised visit room. Upon entering the visit room, the 3-month-old infant is crying and cannot be consoled by the worker. The agency is unaware of this being due to the formula that was provided to the child and is on high alert to watch for an allergic reaction. The agency is later notified days after the removal that the newborn child was positive for methamphetamine. The cries of the child may have been from the methamphetamine withdrawal. While the agency continues to supervise the children, Investigator Nelson moves on to go to the jail to interview the parents regarding the incident and attempt to gain more information regarding the children and their needs.
12:15, ongoing worker Taylor Triebenbach returns to the agency sooner than expected, stating she has an emergency with the case she had just went to transport a parent on. Social worker Triebenbach reports to Supervisor Schoenhart she found her client passed out in a community area, disoriented, appeared to be dehydrated, and not able to make a plan for herself. Supervisor Schoenhart advises Taylor to contact law enforcement to assess the well-being of her client. While the children are still waiting for placement, it is noted that the 5-year-old needs to have a forensic interview conducted. Forensic interviews are only to be completed by trained staff. To have a staff person forensically trained, it costs the agency $1,275 per individual. Currently, the agency has 7 trained staff.
An outside provider, a guardian ad litem, has arrived at the office as she was there to meet with social worker Taylor Triebenbach, and the client Taylor had attempted to pick up. The director, Jenny Lippert, meets with the guardian and tries to locate Taylor as she had not been made aware of the situation. This often occurs where the agency ends up with many emergent situations and not all involved can be contacted fast enough to be made aware of the situation at hand.
12:45 p.m. Intake worker Michelle Wenberg pulls together a screening team with family assessment worker Chelsea Whitcomb and other assessors due to a report of a 15-year-old boy being sexually abused by the stepfather. The agency has to screen 2 times a day or immediately as needed for reports that may result in an immediate response need. Investigator Alicia Sweep interviews the child immediately. Due to the child disclosing sex abuse, the stepfather is called in for an interview and arrested.
1 p.m. Investigator Nelson returns from the jail as the parents refuse to complete paperwork and refuse to talk to the agency. All the children that were at the drug bust or involved need to be taken to MMI for drug testing. The drug test conducted is typically a hair test after removal of a child. This test will allow the agency to see any exposure back 90 days. Each hair test costs the agency $95. For the sake of this scenario, the amount spent on hair testing was $380.
Case aide Cindy Casanova was able to locate placement at Greater Minnesota Shelter Facility for the oldest child. This placement was deemed appropriate for the child due to his sex abuse history and mental health needs. To place in this shelter facility cost the agency $212 a night per child. Case aide Jody Fernholz was able to confirm with a relative from Duluth, Minnesota, they would indeed take the 13-year-old child, however, would not be to the agency to pick up the child until 5:30 p.m. Relative placement was able to be identified for the 5-year-old and the 3-month-old. In order to place with a relative, a social worker needs to go to the relative home and complete emergency relative placement procedures before the children can be placed in the home. Due to the children coming with no belongings, the agency begins to try and gather items for the children before taking them to their above noted placements. Family assessment worker Sarah Banks reaches out to local entities such as thrift stores, charity programs like Foster Stitches, and the county staff to see what can be gathered. The state offers minimal funding for immediate item needs for children. It is often hardest to find basic items for kids in care in short notice.
1:30 p.m. Investigator Carly Krantz has located a 16-year-old boy and provides him lunch at her expense before returning to the office with the child. Carly completes her investigation interview with the 16-year-old prior to bringing him to the shelter facility for placement. During this time, relatives begin to arrive at the agency building, demanding they be able to take the children into their care. Supervisor Sundstrom has reviewed the relatives and they are not a viable placement option. Supervisor Sundstrom has to go to the front lobby to de-escalate the situation and advise the relatives to leave.
1:45 p.m. Investigator Carly Krantz gathers information in her interview with the 16-year-old that warrants her to go and speak with the parents at the jail immediately. Carly requests the 16-year-old be supervised with the other children until she returns from the jail.
2 p.m. Both supervisors check in with all other staff that have not been involved on this case. Jolynn has multiple staff waiting to consult on other cases. Ongoing supervisor Amanda Schoenhart finds one of her staff has to remove 5 children from a relative placement today and needs assistance in finding placement.
3:45 p.m. Ongoing worker Danielle Himley leaves to go and pick up the 5 children that need to be removed from a relative foster home. During this time, Supervisor Amanda Schoenhart works on making calls to find placement for the 5 children. Danielle already had a court-ordered visit scheduled at the office for 5 p.m. on this date. Due to the removal needing to occur immediately, ongoing worker Holly Schmidt and Michelle Tejeda are asked to stay late to supervise the visit for Danielle.
The on-call social worker is asked to assist in seeking placement for the 5 children as they are yet to be placed. Danielle arrives at the office with the 5 children. The children from the initial removal of the day have all been brought to their prospective placements, with the exception of the child waiting to go to Duluth.
5 p.m. Danielle leaves the children with Supervisor Amanda Schoenhardt to go and purchase them dinner. Danielle returns with food for 5 children, which costs her approximately $45.
5:15 p.m. After hours at the agency is never quiet. Many workers are still at the office trying to wrap up the day's events or just beginning work with families that could not meet during the day. I myself stays late to meet with LaToya Gaines to do a court-ordered safety meeting. The agency often has family meetings with identified family members the client provides who discuss how the family unit and relatives can best support one another without agency involvement. These meetings are often held after hours so the family can attend and not interrupt their work schedules.
5:30 p.m. Ongoing worker Dana Rude stayed behind with the child waiting to go to Duluth. She exchanges the child with the relative placement and goes over the paperwork with the placement.
6 p.m. Danielle is still supervising the children in the supervision room when the agency receives notice from the on-call worker that 2 separate homes can take the foster children. Although the agency does not try to have siblings separated, it often needs to occur for immediacy needs. One placement is located an hour and a half away, and then the other is 45 minutes away. Supervisor Schoenhardt assists the ongoing worker in transporting the children.
Danielle and Amanda leave the agency to begin transport for the children. The children had arrived to the agency with all their belongings in 2 garbage bags. Danielle assists the children in putting their items in a county-donated suitcase.
7:30 p.m. At the office is still Supervisor Sundstrom, who is finishing appeal paperwork for other cases and making sure all other staff working late are getting the assistance they need.
8:30 p.m. Danielle has returned to the office and has worked 4 extra hours on this date. This results in comp time at time and a half due to the unplanned removal.
9:30 p.m. Amanda Schoenhardt returns from placing children 1.5 hours away. Investigation workers Jenna and Carly are still at the office working on CHIPS petitions, as these need to be completed and to the courts as soon as possible.
As you can see, the days get to be long and the next day is just the same. Upon getting back to the office the next day, there's an immediate need for an ongoing social worker from Amanda Schoenhardt's unit to be assigned to assist with checking in on placement, notifying schools of placement, setting up visitation with parents or relatives, coordinating services, ensuring court is being attended, and going to internal meetings. Relationships with parents also begin to be developed immediately with the ongoing worker as the case plans need to be completed within 30 days of placement, and those case plans are anywhere from 15 to 20 pages long for each child. A child protection case can be in court for up to a year, and sometimes in certain circumstances even longer. If and when termination occurs, the children then have to move on to our permanency worker, Tina Magas, who works diligently to establish permanency for all children. The investigating workers also have follow-up to do in completing interviews, contacting collaterals for further information, attending court, and trying to locate family out of the country. This scenario specifically has family members that speak a different language and a father who lives out of the country. This adds an extra level of cost and complexity as you need to work with another country's consulate and you need to have all documents and communication translated. These types of scenarios are frequent in Candioi County. The staff you see in this room today work very hard every day to ensure safety of children, support families, and put in time beyond their full-time expectations to achieve safety and well-being of families in Candioi County. On behalf of the Candioi County management team, a sincere thank you to each and every one of you for dedicating your time and energy to your position.
So, thank you so much for that sobering and
dramatic and traumatic, detailed explanation of a day in the life. Before Commissioner Nissen has a question or comment, before I turn it over to Commissioner Nissen, how often in a month does a day like this happen?
In the
Too
last
often, I'm sure.
year and a half, we have seen a lot of increased numbers. In our assessment unit in particular, we have had a lot of methamphetamine-related removals. So this seems to happen often where the drug task force is calling us early morning saying, we've just done a drug raid, we need you to come out. We've also had a significant increase in sexual abuse cases as well as an increase in physical abuse. So a lot of counties during COVID saw their numbers go down. We saw just the opposite. I'd like to attribute that to some of our good community partners, making reports early on so that we could get in and help these families. Also a very active C6 drug task force. And then also our safety networks. We've seen a lot of family members call in saying, I see my family members going the wrong way and they need help. So that's some of why we've probably seen the increase, but we've definitely seen it in COVID. Our numbers have almost doubled.
Thank you. Commissioner Nissen.
Yes, I would, last Tuesday, several of us, Roger wasn't able to, but we went from basically station to station to show our appreciation to all of our employees. I was not able to, I had to leave for a meeting in Marshall, so I didn't get over to your section at all, but I really want to express my appreciation for the hard work you do, and it's very important work. And I hope that you don't have this happen every day, because mental health might be a little bit of a challenge for you folks if it were to happen every single day. But your work is very much appreciated, and I hope you don't have to do this kind of a day every day.
Thank you.
Commissioner Berg.
Yeah, I well understand what you shared with us, and also I also realize that there's more to the story, and this is this one snapshot, and you did a pretty good job talking about the paperwork, but I know well there's a lot more paperwork connected with this. You're trying to cram that all in there, and you didn't talk about travel time, and you only got less than 40 hours a week to try to do all this stuff, and didn't even talk too much about the impact on you as individuals and your family. You don't leave work with a child protection case and go home and totally forget about it. And it's very much appreciated. You mentioned on-call. I'm just kind of curious, what kind of on-call system do you have now? How do you volunteer for that? You rotate it, and with what group?
Yes, we have volunteers from social service agency who volunteer. If we have less than 10 volunteers, then we draw names out of a hat from our social workers in social services. Right now, we've had enough volunteers, so it's a volunteer pool that signs up on a calendar rotation, and they each take about 6 weeks in the year. And we don't like them to take much more than that just because of burnout in our profession and trying to keep that to a minimum.
Well, and there's another thing to add in there too, the training, and you have to have so many hours of training per year, and other meetings connected with that. So it's a lot. I understand that. Thank you. Thank you all.
Commissioner Gardner.
Thank you, Mr. Chair, and thank you all so much for everything that you do. Please tell us, I mean, this is a very enlightening look for us into what you do, because otherwise we would have no idea. But please tell us that you get enough good outcomes to give yourself the strength to come in for the next day and the day after that and the day after that.
Yes, we do see a lot of positive outcomes. We see a lot of children go back home to healthy families, and that's very rewarding in our job. We also do child welfare, so we didn't really hit on that in our presentation, but we also do voluntary child welfare services where people are coming in seeking help before it rises to a child protection level, and we see a lot of satisfaction out of those cases.
Are you seeing more just general mental health calls, that type of thing, folks reaching out to you, especially since COVID?
I think in our intake worker, Michelle Wenberg, she gets a lot of calls and resources people throughout our agency. So she definitely has seen an increase in mental health, chemical dependency, those types of things during this time.
Thank you.
Well, thank you again, everybody, for being
Thank you.
here and all the work that you do on behalf of the families of Kennewick County. Excuse me. And keep up the good work.
Yep, thank you.
Thank you, guys.
Good job.
Thank you.
Much appreciated.
I'm going to get some coffee while they're.
All right, so now we're going to switch gears. So today I am here to go over the two budgets that I oversee. The Human Services budget that includes our child support area, financial support, family child care, family and adult corporate foster care, child protection, child welfare, and adoptions, our Min Choices services, and those services for individuals over the age of 65, disability services, children and adult mental health, chemical health services, and vulnerable adult investigations. And then the public health budget, which includes our emergency preparedness, our WIC nutritional program, environmental health, disease prevention and immunizations, our SHIP program, and then healthcare programs for families and children. Our funding for Health and Human Services comes from state and federal funding allocations, along with grants. These can be very, very hard to budget for, as some are on different calendar cycles, and our allocations are not reliable figures, as these can readily change with the ongoing services we provide. Our staff are always trying to be fiscally responsible and make decisions for the best interest of the client, but also find ways to keep costs at a minimum for our county. I have given you each a sheet, which is a summary. It's a condensed version of the multiple pages that make up our overall county budget with our specific line items for Health and Human Services. So I'm going to go over a couple highlights from each of those. We're going to start with the Human Services summary page. So again, a lot of these expenses are out of our control. 100% county levy dollars are allocated to these different line items. The courts, as you heard from our child protection staff, they can order very expensive tests and evaluations for our clients. The amount of travel that we spend and dollars spent on children in foster homes, the different placement options that we have, abilities to locate individuals and place them in the appropriate facilities, especially for mental health. We're seeing decreasing numbers of homes and viable options that can be very, very costly. And then we did have to invest a lot of money for our child protection team last year. We unfortunately had a great deal of staff turnover, which led us to making some staffing adjustments. So you'll see, I'm going to go through the expenses first. Payroll, you can notice that had one of our largest areas of a percentage increase. And that is because we had 2 staff that we promoted into lead workers for our child protection team, and we backfilled their positions. So we went from 64 social workers to 66 social workers for the 2022 budget. Also, do you have a question?
Oh, no, keep going.
Okay.
You're talking about the personnel.
I'm talking about personnel. Yes, personnel. Also, our child protection staff were given an 85-cent an hour incentive. This was done during our union negotiations. We value these child protection staff. As you heard them up here today, we know that they have a really big responsibility, a big burnout, and so a way for us to entice staff to stay with child protection and stay in those units, we determined that we needed to invest in these staff. We really were seeing a lot of staff move from child protection within 6 months, a year, 2 years, and we want people who work for Candido County to stay in child protection. And so that cost us around $46,940. Health insurance. So again, we're anticipating probably a large increase for our health insurance, and with the number of staff that we have downstairs, that line item automatically had a big jump. I'm going to now take your attention to the services and charges.
The other thing we do in Health and Human Services is the first assistant attorney comes straight from our budget. So that again is a large chunk of dollars that come from us. The other thing with services and charges is the cost of paper services for our CHIPS cases. Those have been shifted to human services. We pay for those. So to put that into perspective, in 2019, we only spent around $1,100. And in 2022, we're anticipating $7,000 for this line item. Court-appointed attorneys, another area that's very costly for our agency. Again, to put that into perspective, in 2020, we were anticipating $290,000 we would spend on court-appointed attorneys. Our actual for 2020 was $409,000. So we're really seeing some areas in the purchase social services that are doubling and tripling. However, I will caution you, that doesn't reflect on the summary page that you're seeing, because we looked at actuals and trends for the past couple years. We saw significant increases from 2020 and 2021 of where we're at right now, but we're hoping that maybe that was due to COVID or some of those things, so we didn't replicate kind of current trends that we're seeing. Another area, child protection evaluations. You heard the staff talk about that. Very costly for us as an agency. Again, that line item has doubled from 2020 actual to what we're seeing now. Supervised living, that is another line item that has doubled for our agency. And this is for individuals who are 18 to 20 years old. And the state had made some changes and are really now through COVID trying to seek these individuals out and get them back on services.
Corky, it's under the services.
Services and charges, I'm sorry, that's still where I'm at.
Okay.
Under the human services, and charges, yep. And so that is another line item that went from $40,000 to $80,000. So again, significant jumps that we're seeing. All of these things are out of our control. There's nothing that that we could do to keep them down with what we're currently seeing. Minnesota Sex Offender Program, our cost shares with the state, that was another line item that has significantly increased. And then we also have one client that we pay a differential for him to be in a safer location. Again, more costly for us at the county, but not as costly as it would be if he was at like Anoka or one of the metro areas. So now I'm going to shift gears to the revenue up at the top of that summary page for the social services. And the first section, you'll see the state and the federal allocations. So we had changes to our SSTS code. Those are code selections that our staff have to pick in order for us to get revenue reimbursement. And the state made changes back in Q2 of 2020. And if we were getting payments from a third-party vendor and we were picking MA codes, they considered that double dipping. And so we had to stop picking a certain code that was very beneficial for us and produced quite a bit of revenue. So again, something out of our control. I know our fiscal supervisor who's here with us today, Carol Tullifson, she spent a lot of time questioning. Our supervisors went to a lot of trainings. We questioned it and it really came back that we cannot pick that code. So that alone was roughly a cost of $700,000 that we are no longer going to receive as the agency. And then lastly, that Secure Blue, so the Blue Cross Blue Shield Care Coordination contract that we decided to end. Again, it looks very bad on paper. In the summary line, you'll see that's our highest percentage to the negative. However, I just want to remind you that what we were trying to do is not have to inflate and add additional expenses on top of this revenue that we were generating. So it likely will take a couple years before we see this dwindle off of our budget. But again, when we put all the numbers together and adding staff to the Blues contract, adding staff to our waivered services area, adding staff to Min Choices, on top of an additional supervisor or some type of management personnel, we really would have been in a worse situation with the budget. So that is the summary that I have before you for human services. And if you want to take questions now specifically to this, otherwise I can go on to public health.
Corky?
Well, I have some questions, but we don't have a whole lot of time here neither.
Why don't you go ahead and do the public health portion of it, and then we'll see what we have.
So our public health budget, our community health board, again, Candy, Ojai, and Renville County Public Health, we have a joint community health board, and that has its own budget, and it's set and approved by our CHB board annually. The remainder of the costs come to each county's overall public health budget. So that's what you'll see, and it's at the discretion of you guys as the county board. So I'm going to go to expenses again. Payroll, you'll see a slight increase for our payroll area. That is because we had one public health nurse in Blue Cross Blue Shield Care Coordination that was a nurse, and we're moving her over to the public health budget because we have additional duties for her to maintain over in public health. We did decrease. We have one staff that went down to part-time, and we had to reduce some vaccine that we usually would purchase because of the fact that Caris Health is now going to be doing flu vaccines in the majority of the schools, so we likely will not have as much involvement with that.
Which means we also don't get the revenue.
So then down to up to revenues, you'll see the fees. That's kind of our biggest area there at 12%. These were increased. We have not increased our fees due to COVID, so that was a pretty large jump there for our revenue. And then also you'll see some declines in our fee for service. And also for our, fee for service, and then also for the donations. But the fee for service, again, that's our family home visiting numbers are decreasing. And again, we can probably attribute that to COVID. More and more people aren't coming in to want someone to come into their home, or doing the visits virtually has been a barrier for our public health staff. So that's an area that we have as a goal to try to increase, and trying to do some creative things there. One thing that is not noted on here that we do know will be coming is our local public health grant. We are getting additional funds from the state with that. Our community health board has to approve that at our next board meeting, which will be this next Tuesday. But there will be some additional funds that will come into the revenue there.
Very good. Thank you for that rather detailed explanation, and a little bit rushed, but we appreciate it. Got time for one or two quick questions? Maybe quick question and quick answer.
Quick question. Go back to the managed care revenue then. On the human services. So we lost close to $700,000 in revenue. But now, then, though, that we had 5 staff to reassign. And 3 of the staff were going to be absorbed. And I thought they would be in positions that would generate revenue, correct?
Yes, and they are, but it's
so
not.
that should cancel out up higher up, right?
Yes and no at the same time.
Okay.
They are in positions other than the one that generates revenue. However, especially in our min choices area, and now what I had talked about with that SSTS code selection, that's where we made quite a bit of revenue, and the staff were able to generate more to cover their salary on top of adding extra revenue to the agency. So with that and the min choices, it's not identical, the same amount of revenue as what we would have seen with the straight Blue Cross Blue Shield contract.
How much is the difference?
Larry,
we would have to really pull the numbers. It's hard to know until the staff actually get to their area, so it's probably not going to be something that we can allocate until we get a couple months into this next year to be able to cross-reference that.
Larry, maybe you can.
So what it is it's not just the managed care piece, or for Blue Cross Blue Shield. It's other program areas also. So it's not just the Blue Cross Blue Shield contract that we terminated. There's other factors that come into that.
Budgeting for it, can you not come up with a number that you budgeted for that?
We did.
Yeah, and it was
That's
7.
what I'm saying.
So
And
without,
how much was that?
The numbers right here,
the
though.
Blue Cross Blue Shield, and you'll see it's the highest. It's I think it's at negative 73% of our budget. It was $710,000 that we totally took out of the budget, and that was straight revenue.
And you'll get a detailed line by line of the budget when we go through it on the 26th.
And you'll see that.
Yeah.
Jenny's not able to be there on that day, And that's why we're presenting it today. So, and also my goal was to try to get it to you in pieces and so you're not eating the elephant in one day.
Well, thank you very much. I'm gonna cut this off. You can talk to her individually if you
Okay.
need to, because we need a few minutes before we start our next meeting. I will adjourn the Kennesaw County Health and Human Services Committee.